The timeless phrase, and I'm quoting now, "an ounce of prevention is worth a pound of cure," unquote, by Benjamin Franklin in the 18th century, nudging his countrymen to be vigilant about how to prevent fire, resonate with us still. Now, prevention of many ailments and sicknesses, especially emerging ones, will continue to be hindered until there is a general awareness of the epidemiology and mode of transmission of bacterial or viral infections. And as simple as it may sound, frequent hand washing with soap and water has been the hallmark of prevention in public health. Now, COVID-19 pandemic has only made cultivating that habit even more imperative for everyone, but more specifically for those living in the villages and rural communities. Now, in all of the recommended sanitation and hygiene protocols for flattening the COVID-19 curve, water is very critical. In the absence of a known cure for COVID-19 and indeed other gastrointestinal diseases, hand washing with water and soap is not only the best preventive option, but also the most cost-effective, or so it seems. It is considered the first line of action to preventing contracting and spreading of the COVID-19 virus. Now, effective compliance with this protocol would, however, hinge on whether or not you have access to safe water. Now, according to the United Nations, planet Earth is covered with sufficient fresh water, therefore it should not be difficult to sustain human requirement of it. But unfortunately, human and natural phenomena like droughts and desertification have induced water stress in many countries of the world, including Nigeria. So for us, 2017 NBS indicators are flagging a red signal. Now, here are the statistics. 69 million Nigerians cannot access safe water, and 19 million others have to trek long distances, as near as 10 kilometers, now that's the statistics we have, to get water for their domestic use from rivers and streams. But much of the challenge of poor access to water and hygiene is experienced in our rural communities, semi and urban slums in different parts of the country. So, will Nigeria be able to cope with COVID-19 pandemic without improved access to water? And I may add, safe water. If the indicators are anything to go by, then we've got a lot of work in our hands. That's why this week on the edition, we look at how COVID-19 is impacting on our water resources and how we are responding to the emerging reality in that sector. I am Claire Adilabu Abdul Razak. Thank you for joining me. Engineer Suleiman Adamu has a very rich pedigree in project implementation and management, both at the private and public sectors. He has supervised implementation of very many water supply projects at the rural and urban areas in the country. Engineer Suleiman has a wealth of experiences also in the consulting industry and co-founded one of the leading civil structural engineering firms in Nigeria, and that includes Integrated Engineering Associates, IEA, I beg your pardon. Now, as the team lead of a management consultant to the defunct Petroleum Special Trust Fund, Engineer Adamu was instrumental to the planning and preparation, as well as delivery of several national infrastructure projects in the health, education, transportation, agriculture, including water resources and also energy sectors. Now, as a project manager, he supervised implementation of several projects under the PTF urban, semi-urban, regional and rural water supply programs, National Farm Power Machinery Rehabilitation Program, and also National Waterways Development Project. That's, of course, dredging of the River Niger. Now, he was the project engineer and designer of Woodhill Water Treatment Plant Civil Works. Engineer Suleiman Adamu is a two-term 7 Minister of Water Resources. He was reappointed in August 2019. He chairs the Council of Ministers of the Niger Basin Authority, NBA, and Lake Chad Basin Commission, LCBC. His wealth of experiences have come to bear on the Nigerian water sector. He is driving a web of partnerships to accelerate achievement of the 2030 Development Agenda, especially SDGs Goal 6. He holds a bachelor degree in civil engineering from the Ahmadu Bello University in Zaria, an MSc in project management from the University of Reading in the UK, a member of many professional bodies, including Council for the Regulation of Engineering in Nigeria, Korean, and Nigerian Society of Engineers. My second guest is Saad Ibrahim Bello, is Commissioner for Water Resources and Energy in Plateau State. He is a seasoned administrator and strategist. He holds a bachelor degree in technology from Abubakar Tafawa Balewa University, Bauchi, and a master's in public administration from the University of Jos. Saad Ibrahim Bello is also an educator and served as head of science department and also education officer and vice principal at the Plateau State Ministry of Education. Now, as a politician, he was member of Plateau State House of Assembly, deputy minority leader, and chairman, House Committee on Solid Minerals and Environment. Saad Bello started his career as a public servant and as a principal training officer with, of course, NEMA. He was head Zonal Operations Office, NEMA Sokoto Operations, later served as head of the Internally Displaced Persons IDP Camp Coordination and Management in Adamawa State. He was instrumental in the design and training of staff of NEMA and other interest groups on disaster management, preparedness, and other very strategic initiatives. Now, he also has, is a member of many professional bodies, and including, I just want to name a few of them, Nigerian Pandemic Disaster Response, Consultancy Management course, and he's also had basic management development training. So, ladies and gentlemen, join me as I welcome the Honorable Minister of Water Resources, Engineer Suleiman Adamu. Thank you very much for joining me on Late Edition.
Thank you.
And also, Commissioner for Water Resources in Plateau State, Saad Ibrahim Bello. Thank you very much for joining me.
Thank you very much for having me.
Honorable Minister, quickly share with us the shared responsibilities of governments in terms of water provision. Who does what, you know, within the provision of the Constitution and in reality?
Thank you very much for having me on this program. First of all, water is, I think, it's on the concurrent list. Therefore, there is a shared responsibility between the federal government, state governments, and even the local governments. As used to be the practice, or as it's supposed to be the practice, federal government deals with bulk water. We manage the water resources of the country, and over the last few decades, we've been involved in provision of reservoirs, dams and reservoirs in those areas where water is scarce, so that state governments could harness, treat, transmit, store and distribute to the population, to the populace. And then, of course, local governments are supposed to also support, maybe at local government level, for rural water supply. But even then, for several years, successive administrations have found the need to also intervene where necessary, support the states by way of complementing their efforts in providing, especially for rural populations. But we've also been involved in urban water interventions in urban water schemes through federal budgets or through facilitating external funding from development financial institutions to support large-scale municipal water schemes. That's why at one time we have the National Water Rehabilitation Project in the 90s. And then, of course, in the last several years, we've had the National Urban Sector Water Reform Program or project that has been facilitated through a World Bank loan, and the Federal Ministry of Water Resources has been coordinating. And then there have been some specific interventions, either mostly on the request of state governments to provide some urban schemes or to complement their efforts. So we've done schemes like we've supported Lagos State, we've supported Kaduna State, for instance, with the Zaria Water Supply Project, where the federal government built the dam, and then the states handled the other components of the project. Quite a number. We're still doing a lot in that respect. Then, but we have had cause to look at the National Water Resources Policy recently in the 2016, and we came to the position that federal government can support states with up to 50% support for rural water supply, and then for urban water schemes, maybe about 30%.
What are the components of the support?
Well, it doesn't matter. It's just this is the budget. Whatever is their budget, we have to agree that it's project specific. But whatever the investment they want to make, the federal government can support them by up to 30%. And then for rural water schemes, we can also support by up to 50%.
You know, when you say support, I just want, is it support in terms of, you know, providing some kind of funding or
yes.
Actual, you know?
Yes, of course. We can look at, yes, it depends. We can look at certain components of the project and say, okay, this component, ABC, federal government will provide the funding for it. Not that we dish out the money to the states. We take certain components of the project worth that percentage, maybe a little bit more, maybe a little bit less, and provide. But in a lot of cases, it's been quite even much higher than the 30%. And most of the projects are inherited. The federal government support is probably as much as 80–90%. Has
this been ongoing, or is this a paradigm shift in policies now?
No. What we realized, unfortunately, is that some states have, over the years, been abdicating their own responsibility because they think they just run to the federal government, and the federal government does some projects for them. So in some cases, 100%. But even to manage the schemes after that has become a problem. And you cannot expect the federal government to go about and be running and managing their schemes. The federal government does not have a water board. So, and
there's so many of such schemes abandoned.
Oh, definitely. We finished a scheme in 2016, a regional scheme that is, I'm just giving an example, to provide 13 communities in Bayelsa State with water. We handed over, it cost the federal government $6 billion to do that project. We handed over the project to the state. A year after, we went back to check how things were going, and we found the project under lock and key. And when we asked, they said they cannot run it. To spend 2 million naira to buy diesel and chemicals and so on to run. I mean, so you can see the frustration. There are other schemes that I know also. A dam was built, a treatment plant was built, a 60,000 cubic meter per day treatment plant. The federal government did its own bit 100%. The other component was for the state to do the transmission line and distribution network within the towns to extend the water, to reticulate, to, you know, even the treatment plant had been done. But up to now, more than 10 years, it hasn't been done. But I give credit to the current administration in the state because I think they've now negotiated with the French Development Agency, and they're likely to get some funding to do it. Then there are states also like Rivers, where the federal government facilitated them to get about $200 million or $280 million support by the World Bank and African Development Bank to improve the water supply situation in Port Harcourt. And then a new administration came in 2015, and turned everything upside down. And unfortunately now, the World Bank and the African Development Bank, they are withdrawing. So, you know, the problem is, I think many past administrations have not, and even some existing administrations have not been giving water the priority that it deserves.
Thank you. Let me put you on hold and bring in the Commissioner for Water Resources and Energy, joining me, of course, via Skype from Plateau State. Honorable Commissioner, what is water supply a priority for you in Plateau State?
Thank you very much for having me in this program. And I will start by first appreciating the leadership role the Federal Ministry of Water Resources is actually providing to states, especially the role the minister is playing in trying to revitalize moribund facilities in almost all the states. Here in Plateau, we are blessed with a governor that is very proactive and is passionate about water. Let me say, when he came on board, actually the water sector is very much in a serious state of decay. And so he had to declare, first he has to make, bring up the reform process and also follow the federal government in declaring a state of emergency in the water sector. This has provided the government with the impetus to pursue the reform process. And that we have done with all sincerity, and we have achieved a lot in terms of water governance. We have provided the structure, the enabling policies and the enabling laws have been made, signed, and gazetted. We have a new water sector law, which seeks to demarcate responsibilities to three major agencies as a deviation from the previous, where the water board seems to handle all provision of quality water, both in the city, the semi-urban, as well as in the rural communities. Now, the law has clearly spelled out responsibilities for the City Water Corporation and the State Municipal Water Area Council for small towns, and has also clearly spelled out the role the State Rural Water Supply and Sanitation Agency is expected to play in the provision of rural water. All these are aimed at trying to achieve quality, affordable, and sustainable water supply to the people of Plateau State.
Back to the Honorable Minister, you heard him in terms of statistics and indicators, that were provided by NBS and partners. 8% of those who do not have, just about 8% of people in rural areas, communities, have access to safe water or drinking water, and even more so, just a mere 18% in urban areas. Now, does this define or reflect the situation in our rural communities and even, urban slums?
Yeah, well, the current statistics actually indicate that in the last 2 years, we've made a small progress in terms of access to water, moving from 68% to 70% coverage nationally. That also includes a slight increase in the states. But that's if you take it on the basis of the Millennium Development Goals criteria. But when you take the SDGs criteria, which is very, very rigid, we are very, very far from it, honestly. I'm glad
you're saying that. It's
tough. You see, these are all the reasons why on November 8th, 2018, President Buhari declared a state of emergency on the water supply, sanitation, and hygiene sector, and launched a WASH action plan that will see us meeting the Sustainable Development Goals by 2030. Now the challenge is for us to have the political will and to invest as necessary. But this issue of water supply cannot be done all by governments or through budgetary allocations. We will never have that kind of money to do this. And that's why...
But that's why you're having PWASH.
Yeah, that's why we have PWASH, where we want to harness everybody, development partners, ourselves, federal, state, local governments, even leverage corporate social responsibility funds and donations from foundations and so on and so forth. And I've been making a call that we should please start spending less money on churches and mosques and filling stations and channel most of that money to education and water. Because even less than 15% of our schools and health facilities are enjoying water. So, and when you, I know we're coming to COVID-19, but you can see the challenge that we're facing. We need to invest more. We need to prioritize water. We should leave vanity aside.
Yes, but the PWASH that was launched in 2016, you started with, you know, some states as pilots.
Yes.
Give us an insight. What's the content now?
Yeah, we had a very successful pilot project in 2 states because Kano and Ogun states were the first 2 states to indicate interest in the program. So we launched a pilot in those 2 states. Between those 2 states, we have either built or rehabilitated a total of about 730 water supply schemes in about 8 local government areas. And the way we are taking PWASH is we take a complete local government and we make sure we deal with all the water challenges and ensure that there is 100% coverage. But the PWASH plan is that it's not going to be done all alone by the federal government. You know, if you go around the country, since the Shagari regime, where we had the first launch of a national borehole program, there are so many boreholes in this country built by the federal government, and they are there, they are wasted. Nobody is taking ownership, and they are not working. And over the years, it's been like that. Statistics indicate that close to 40% or more of the borehole schemes that we provide don't last more than 8 years. You know, so we now have to come up with this program. We want a partnership. We're now saying that for those states that have not been investing in water and only relying on annual federal government intervention, that is no longer business as usual. We now have to partner. You know, it's a two-way traffic. We're going to take 2 local governments and make sure we address all the water requirements for those local governments. And now with sanitation too, because we need to provide toilets in markets and other public places. And the state government must also bring a counterpart contribution for 2 local governments. And that's where we have 4. So the whole idea is to incentivize the states to be investing more. When they see that now, first of all, it's like a carrot and stick approach. When they see now that federal government is no longer going to be bringing its own money and just building boreholes and going away.
What's the response so far?
Well, 33 states out of 36 have responded to the protocol. Now we're starting with 10 states. We just recently launched the PWASH program. That's the second phase, scaling it up, but we're starting with 10 states because of first of all, those 10 states are the only ones that have fully met the criteria. Well, fully, 90%, because I would also, up to now, we have not seen them award their contracts, but we know that many of them have made a budgetary provision, and some of them have even gone to the extent of opening an escrow account or a special account to keep the money for that purpose. And those 10 states made that criteria, so we are starting with them. But other states have been coming, and maybe the next phase will now take up another set of states and begin to go like that.
Well, what is the role of Plateau State? Is Plateau State among the...
Plateau State, I'm coming to the Plateau State. I will commend Plateau State very well. The first day that we were having a meeting with the World Bank when we had done a survey prior to 2015 on the water supply situation in the country. And it happened that on a particular day that the World Bank came to provide this, to unveil this report to us about the situation. I got a call that the governor of Plateau was coming. So just before he came, I made them extract all the e-data as it affected Plateau State on water and sanitation. And immediately he came, while the World Bank people were still there, I showed, I said, Your Excellency, this is how bad your state has been doing. And to his credit, he took that matter very seriously. The very next day, he started acting. And Plateau has been one of the first states to declare a state of emergency following what the president has done. So far, only 16 states have done so out of 36, but Plateau State has been among the leading states. Honourable
Minister, let me put you on hold and also put the Honourable Commissioner for Water Resources on hold. We'll just take a short break. Just in a trickle of an eye, we'll be right back to continue our conversation. This is Late Edition this week.
The main way coronavirus spread is when infected people sneeze and cough. Small droplets of fluid expelled by cough or sneezes are laced with viruses looking for new respiratory tracts to infect. When a sick person sneezes around someone who is healthy, the virus can land in the nose, mouth, or even the eyes, causing an infection. Symptoms can include fever, cough, shortness of breath. Symptoms may appear within 2 to 14 days. Seek medical advice if you develop symptoms and have been in close contact with a person known to have COVID-19, or if you live or have recently been in an area with ongoing spread of COVID-19. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Welcome back, and you're watching Late Edition. This week we are looking at the water component response to COVID-19, and I have with me in the studio the Honourable Minister for Water Resources, Engineer Suleiman Adamu, with me. Thank you very much, Honourable Minister, for coming. I also have joining me via Skype from Jos, Plateau State, the Commissioner for Water Resources and Energy, Saad Ibrahim Bello. Thank you very much for joining me. So let me start with you. Honorable Commissioner, we have increasing number of COVID-19 cases coming from the communities. Now, is there a compelling need for more water now than ever before?
Well, I think the COVID-19 issue is actually coming in at a time when the Ministry of Water Resources is doing its best to ensure that there's a behavioral change in terms of how best we utilize water to achieve sanitation and hygiene. And thankfully, too, the most important aspect that the COVID-19 prevention needs is water. All other practices come with water. All other things that are required for us to prevent the spread of COVID-19 comes along with water. And therefore, I could say it has come at a time when we need to harness what we have been planning so that people can understand why wash service is very necessary. Before the COVID-19, you take a lot of time to convince somebody to embark, especially in the rural areas, to imbibe the culture of sanitation and hygiene. But now, I think we are seeing the reality. We have seen that the use of water, sanitation and hygiene is actually inevitable in our struggle to contain the COVID-19 virus or disease. The state actually is having an increase, as you rightly said, but the increase is also as a result of the fact that we, as a state, we have taken a giant step to ensure that the government provides access to testing. So as people are being tested, more number are coming up, and that goes to tell us that we have a lot to do in terms of trying to prevent the spread. That is why the water sector is very key in our drive in fighting the COVID-19 pandemic. The Honorable Minister has actually charted a course in terms of bringing us all the commissioners of water resources to a roundtable discussion to respond to the COVID-19. We are actually doing, engaging and partnering with the federal government to design a framework for which we can respond to the COVID-19. This has been very, very successful, and it is giving us a kind of unified approach to how we can respond to COVID-19 in our various states.
Thank you, Honourable Commissioner. Engineer Adamu, you listen to him. Water is very critical. Indeed, when I watched the promotion of how to achieve effective hand washing with soap and water, the amount of water you actually need to, to wash your hands, is quite much and all that. What is the weight of the responsibility that COVID-19 has brought to bear on your ministry in terms of water provision? Well,
a lot, but not on my ministry alone, but on the entire water sector, and especially at state level. We are doing what we can. First of all, I think I had an interview one time. I said, if only people had listened to all the things that we'll be doing. Every year we do this. There's a National Hand Washing Day. We come out, we go to commemorate it. We go to schools, we encourage this. And if only people were doing that, have taken that very, very seriously. But beyond that, COVID-19, I say, is a wake-up call for all of us. If you've been paying lip service to provision of water supply, now we can see even more the importance of water. A lot of people have been dying of water-related diseases, especially children. Like 200 kids die, babies, children under 5 die every day in Nigeria from diarrhea and so on and so forth. But these are, you don't hear this until this big man's problem came with the COVID-19, where we know death is staring adult populations in the face. So it's been a wake-up call. So what we've done when we saw this, say, okay, first of all, we need to leverage all the campaigns that we're doing on hand washing, open defecation, free campaign, the need to invest more in water supply. This is the time to hammer this message to those that are responsible, and we've been doing that.
Did you have to change any policy? Did you have to think out of the box?
Not really. I think it's the normal thing. But the only thing is that we need to accelerate now. It has become more important for us to put in money as quickly as possible. But what we can, as far as we're concerned, what we can provide is guidance. So we set up the COVID-19 Wash Response Committee, chaired by me, and comprising of all the state commissioners. We developed, with the support of our development partners, guidelines on how to deal with the pandemic as far as water, sanitation, hygiene are concerned, and disseminated with the state. Then we also went to the extent of, through this 500 billion naira economic stimulus that the president has approved, we've been able to get about 10 billion naira out of it, because we're the first, without even being requested, to send a request to the Ministry of Finance to put our plan that this is what we intend to do.
How will this translate to availability of water and good hygiene facilities for people in the rural areas? Because that's where we're having this.
We have a population of almost 200 million people in this country. Honestly, it's a drop in the ocean. But at least something needs to be done. In this year, we have looked at every facet. We're going to look at communities. It's all targeted at rural communities anyway, as far as the water supply is concerned. We're looking at rehabilitating 5 schemes, because we know a lot of schemes are moribund, and we're per state, and we're also going to do 5 new schemes per state. And then we're supporting the state government with some inputs in their water schemes. For instance, some of them have problem of diesel or chemicals, or laboratory reagents. And we've asked them to give us specific requests worth a certain amount of money, and they have done so. So we'll provide support in that respect. Then we're looking at public places, all these contactless systems for washing hands, plus the soap itself. We're also providing.
Okay, I just have a few minutes to, take a break, another break. Honorable Commissioner, all over the country, institutions and governments are trying to improvise access to water and good hygiene facilities, especially for people in our communities, because this is where we are having more cases of COVID-19 and all that. So what are the innovations that you have come up with to ensure that our rural dwellers comply with this particular provision of good hand washing?
Well, thank you very much. Here in Plateau State, the fight against COVID-19 has actually come at a time when we are very serious about water supply services. And the innovation we have actually tried to bring up is to encourage PPP, private-public partnership, where some corporate organizations are being sensitized on providing the hand washing facility in their premises and in other public places so that it can help in curtailing the pandemic from spreading. We have also activated the wash departments at the local government areas, which particularly this time around, their major responsibility is to sensitize the local communities on how best to utilize water to cope the spread of the pandemic. So apart from that too, I told you earlier on that we are in a reform process. The water agencies that are saddled with such responsibilities are also being charged. And we make sure that we divert a chunk of our resources, the little resources we have, in trying to make these agencies respond to the COVID through sensitization.
Honorable Minister, in the wake of the ease on lockdown, the PTF warned us, Nigerians, that it is time for us to take responsibility. And of course, with the hand washing protocol, which is the first line of preventive measure, how might people in the rural areas effectively comply with this when they have to trek long distances, to access even water for their domestic use?
Well, it's a sad story. There's very little they can do. But when we were growing, although I didn't grow in the village as such, but I know that sanitation has been everybody's business. Anybody, it's a personal business, and even in villages, in communities, I mean, there are traditional methods of providing doing some hygiene practices. So I can only hope they will continue to do that. But like I said, we were caught unawares, but we shouldn't have been, because for several years, for several decades, we've been paying lip service to water supply in the country. If we had been doing all the things that that needed to be done in terms of provision of water supply to the people, we would not be where we are today. So the only thing I can say is that I hope that lessons have been learned, especially by our state governments and local government authorities, to the effect that water is important, is the most important element in our life, in our individual lives, and that we should begin to take it more seriously. Because if this pandemic happened now, it can happen again, God forbid, but we shouldn't allow this to happen to us again. They say once bitten, twice shy. But the only thing is we step up the process to continue to provide water. I think the most important thing is to, it's all about planning and resource allocation. State governments know the communities. It's not, the federal government cannot be in every nook and cranny of the country. It's the states and the local authorities that know all the villages, the wards, the slums, and everything. So they should plan very well, look at those areas that are extremely in need and start with it, give them priority.
And the commissioner just mentioned that there's a committee that's supposed to come up with response plan for COVID-19. What are you expecting of them?
No, we have done that already. They have already done their responses, and that was what I was referring to. At least at federal level, this is the support we are providing for them. But at state level, we know they're doing a lot. And periodically, we have virtual meeting, and all the states, they tell us what they are doing, and we manage with the progress.
All right, Honorable Minister, you've just launched the PWASH, I think the second phase of the PWASH recently, and I understand only 10 states were selected. Is there a particular reason for, just limiting to 10 states?
Well, before we got to this stage, PWASH has gone through a lot of stages. First, we developed the program between February 2016 and November 2016. We got it launched by the Vice President in 2016, November. Since then, we set up a coordination office. We sent information and guidelines to all the states, unveiling the program, telling them this is what is required. And like I said, at the initial stage, 2 states responded, Ogun and Kano. And then subsequently, we reached about 10 states. By the end of the first term of this administration, we had 22 states that had indicated interest. But then indicating interest is one thing. Then you also need to comply with other aspects of the protocol. We needed to sit down with them, compile data, to do some proper planning. And that's been going on. So of course we're doing it on the basis of first come, first served basis. So when we got to this stage, the last stage was now commit. We need financial commitment. And only those 10 states came. Happily now, since the second term of this administration, we've got additional states. That's where we got from 20, we moved from 22, we got another 11 to 33. So that's another progress, but there's still some work to be done. We've had series of workshops with them. We sent information, we sent templates for them to give us data. We sent our teams to work with them to be able to develop the information, to be able to even select the local government. We didn't go to select this local government. We worked with them to select the local governments, which are the ones that I think are a bit more deprived. So we decided to give them a priority, So that's how we evolved, and we got to these 10 states. Now, as we start with these 10 states, we are hopeful, and I'm sure the PWASH coordinating office is working with the other states to now build them up to speed until they get to this level where they comply, there's full compliance with all the procedures and the protocols.
What would you adduce to be the reason? Is there any state in Nigeria today that is sufficient in terms of water provision, that doesn't have a challenge in this area?
Absolutely not. And to make it worse, there is not a single city in Nigeria that enjoys pipe-borne water supply or access to water supply 24 hours a day. And to make it worse again, we're beginning to see in our surveys that even in lots of places where you have pipe-borne water, the water is not actually fit for drinking. There seems to be some contamination at some levels. There is a lot of problem associated with the water supply, associated with water supply delivery in this country. And that is why we must stop paying lip service to it and really address the situation and put our money where our mouth is.
Honorable Commissioner, let me ask you the last question. What are the challenges you have in reticulating water down to the rural areas so that people can have, water available to comply with the protocols? And then secondly, what are the lessons you think we have learned in terms of provision of water, from COVID-19?
Well, the most important challenge that government has in terms of providing water to the community rests squarely on 2 things. One is the wherewithal, the resources available. You could have very beautiful plans, but when the resources is not there, then certainly you have to do certain things to even though your limitations, you have to live with the limitations. And secondly, the lesson learned from the COVID-19 is that it is a wake-up call for us to have behavioral change. That is what we put in the front burner to try to sell to the local people, the people at the rural areas, for us to imbibe sanitation and hygiene practice, which will go a long way in curtailing the effect of this and other diseases that will come up, not necessarily from viruses, but even from issues like diarrhea, E. coli, and so on and so forth that could be minimized when we have proper hygiene practice.
You have an extension of COVID-19. Do you think Plateau State can survive in terms of water, washing of hands?
Yes, we are doing a lot to ensure that we are up to the task. There are numerous challenges, but I think we have extended hands of friendship and fellowship with a lot of organizations, and thank God with the support from the Federal Ministry of Water Resources. I think we are good to go in terms of providing accessible, affordable, and sustainable water in the next 1.5 years or 2 years.
Okay, let's come back again to the minister. Now, among the states that have keyed into this very laudable initiative that has been watched, can you beat your chest to say these people are doing well in terms of water provision?
Well, at least the fact that we've come this far with them shows that there is more political commitment. That's number one, and this is the number one thing. If there wasn't political commitment, we would not be there, because I believe the governors were pushing. They were asking questions, they were tasking their teams to be able to get to that point. And at the end of the day, budgetary allocation is the business of the government and at the top level. And where you've seen that the governor has made provision, then you know it's a clear demonstration of political will on his part. So I would say that yes, we're on course. And many of these those participating states are among those that have already declared a state of emergency, which is another way of indicating political will. You know, believe me, when President Buhari launched this WASH action plan and declared a state of emergency in November 2018, we networked with a lot of international agencies. I say this is the first time in Africa that anybody is doing this, any government is doing this. And it attracted a lot of interest from the international community, that yes, Nigeria is making a commitment at the highest level that it must deal with water situation. Go and see what India is doing. That's the other country that is doing the same thing. In the next 5 years, India took 5 years to rid the country of open defecation because the Prime Minister took the driver's seat in that. Now that they've successfully done that, they are saying that every rural community will have access to potable water in another 5 years. They are committing huge resources. They committed $20 billion to just end open defecation in India, taking 600 million people out of that practice.
Do we have a similar timeline? And
yeah, for open defecation, our target is 2025. But for water supply, we are going by the SDGs target of making Nigeria water sufficient by 2030. India is committing $60 billion in the next 5 years to make sure every village has water supply. And it's a federal state, just like it's a federal country. It's a federated country just like us. But the states, almost the same number of states, the states have keyed in to the vision of the Prime Minister, and they are committing their own resources and getting counterpart funding from the federal Indian federal government, as long as from the international development partners. That is the kind of buzz that we want to create. This is the kind of template that we're working on. But if the states, some state governments are dragging their feet, we will not be able to get there.
Okay. If the Commissioner for Water Resources joining us via Skype is available, Commissioner, okay, he's not there. I wanted to ask him, declaring an emergency is one thing, but, you know, enforcing or implementing, or even the components of what this emergency entails, it's another. So when you say you declare emergency in water sector, what does it actually mean?
Well, it means, number one, that we're going to accord top priority to water.
Yeah, because they don't even have master plan. You raised that.
That's the point. But the declaration did not come just by word of mouth. It also came with an action plan, the WASH action plan. So it was a two event in one on that very fine day of November 8th, 2018, when the president made the declaration of state of emergency. He made the declaration, and launched the WASH Action Plan. In that WASH Action Plan, the specific roles and responsibilities of the federal government through the Federal Ministry of Water Resources were spelled out, and the responsibilities of the state governments and local governments were also spelled out. So what we need to do, and it took a lot of time for us, a lot of effort working with our development partners, especially the World Bank, to develop that WASH Action Plan. So all we need is for the states to key in and to do all the things that they need to do. And there are timelines, there are even, in some cases, cost elements to this. And I made a presentation to the Governors Forum on this. I made a presentation to the National Economic Council, where all the state governments are present, and they are all aware of these plans. But like I said, up to now, only 16 states have gone ahead to declare the state of emergency, not to talk about even implementation of the WASH Action Plan. So if the states, no matter what the federal government does, no matter what investment and time and policies and strategies that the federal government put in place, if the states do not key in religiously to these plans, then we're not going to get there. So we need to get these plans and policies domesticated at subnational level, and that's where lies the challenge.
You know, even at the national level, funding is you know, a challenge for many sectors.
I totally agree with you, because in the last 2 years, I've had cause to have to go to the National Assembly to plead with them not to toggle with the water and sanitation, water supply and sanitation budgetary provisions. So it's very important that we also at federal level get the support of the National Assembly to ensure that we get adequate funding, that whatever funding request we put, it's adopted. We're also talking, we have an interministerial committee in which the Ministry of Finance is a member, towards, you know, for her to appreciate, for the Ministry of Finance to appreciate our needs and the importance of providing water to the people. And luckily, so far, so good. And I've seen this demonstrated where we made this presentation on this COVID-19 from the request from the economic stimulus package. We didn't have any objection. We're very well supported by the Ministry of Finance, Budget and National Planning. And that's the kind of thing I want to see. Water is the most important element. All creatures came from water. It's the basic necessity of life. And you can stay for days without power supply, you can survive it. But imagine your household without a drop of water, you know?
So I'm going to ask you my last question, and that's the question I started with, you know, in the course of our conversation. Will Nigeria be able to cope with COVID-19 with what we have in terms of water provision at the moment?
Well, we'll make do with what we have. I just pray that the COVID-19 pandemic does not escalate beyond what it is today. I think generally people are managing, are coping with the situation. But if it blows beyond proportion, then we're going to be in deep trouble because we don't have the water infrastructure on ground to support this basic idea of using running water to wash your hands for 20 seconds. Obviously, it's not there. We can only improvise, as we've been doing. Even I know some communities or some states are commandeering even water tankers to transport water to locations. And this contactless hand washing facilities, you know, doing something. But like I said again, this issue is a personal matter. It's personal hygiene. People should find even other ways and means. And I'm so happy that local sanitizers have been produced from herbal concoctions here and there. So we'll get by, but if it explodes beyond this level, then we're going to be in trouble. But what I'm hoping is that for all of us in Nigeria, and for all people involved in government and even the private sector, they now see the importance of water, that lessons would have been learned.
All right, we must thank you, Honorable Minister of Water Resources, Engineer Suleiman Hussein Adamu, for joining me on this conversation. Thank you very much for your patience. I really appreciate it. All right, Sir Ad Ibrahim Bello, Commissioner for Water Resources and Energy, joining me via Skype from Jos, Plateau State. Thank you very much, Honorable Commissioner, for your time.
Thank you very much, Madam.
And that's it this week for Late Edition from me and my production crew. It's bye-bye.